gun violence is finally being treated as a public health crisis.
I'm about to freak this. Ha 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 ha. What?
Welcome back, you guys. Thank you very much for joining me. My name is Swardik Mayanja, and this is the Mayanja Accredited News Network. You guys can call me Q. So a study in the Journal of the American Medical Association showed that gun violence should be treated like a public health crisis. So just a quick background on some gun violence statistics. Every year in the U.S., more than 30,000 people die from things related to guns. This puts gun violence ahead of diseases like HIV, Parkinson's disease, malnutrition, hypertension, and a whole list of diseases that us Americans are afraid of. Gun violence affects and kills more people yearly than all of those diseases. So in Chicago, they had a horrible 2016 when it comes to gun violence. This is where the study happened. Internal medicine researchers studying gun violence in Chicago looked at arrests and other data over an 8-year period, not just 2016, over an 8-year period, and they came to the conclusion that gun violence should be looked at and studied as an infectious disease, similarly to an infectious disease. All this means is just how infectious diseases work. You infect people, right? It just doesn't miraculously happen. You get infected by someone else or by some other thing. So if I were to be shot, those people who are my friends, my family, they would be more likely to get shot. And my friends' families, my family's friends, my friend's family, those people, and it grows and grows and grows just like that. So why does it matter? Why does it matter if we look at gun violence as a public health crisis? Number one, you get more money. More money for more research, and more research to help better understand the situation and then fix it, stop it, and prevent violence from happening and continuing. And the reason I say you get more money is because in 1996 a congressional appropriation bill banned funding from the Centers of Disease Control and Prevention to be used to advocate or promote gun control. And the reason they did this, and it's not just the Center of Disease Control, they also did the same restrictions on agencies like the National Institute of Health. The reason they put these restrictions on them is because they saw gun violence as a law enforcement problem, not a health issue. They thought it was bad people doing bad things versus an actual epidemic or problem that is spread throughout the nation. I think the other reason, and I think this is probably the biggest reason and the most important reason why we're switching from a law enforcement problem to a health crisis, a public health crisis, is because this takes the morality out of gun violence. And it's really hard to look at gun violence without thinking of morality, because gun violence is someone killing someone, or someone shooting someone, accidentally, not accidentally, domestic violence, gang violence, all of that stuff. It's so much emotion in all of those things. It's not like the flu, where you just get the flu and you're not a bad person if you get the flu. You just get the flu. You just get sick. No one looks down on you for it. But now that we're switching from looking at it as a law enforcement issue to a health crisis issue, we can open our minds to the idea that maybe it's the situation, it's the culture versus it's the person, right? It's bigger than just that one incident. It's an epidemic. It's happening all over the country, everywhere. So tell me what you guys think. I think this is a great step forward. Leave your comments below, like, subscribe, and then catch you guys later. Thank you. Bye-bye.